Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Mahesh Moolani. He's an internal medicine physician, and we're going to talk about the KevinMD article, a unique method for managing chronic bowel conditions, treating fecal impaction, and preparing for colonoscopy procedures. Mahesh, welcome back to the show.
Thank you. Thank you, Kevin. Thanks for having me.
So we were talking offline. I think you were on when the podcast almost started 3+ years ago. So great to have you back on again. And for those who didn't listen to our first episode together, just briefly share your story and journey to where you are today.
So yeah, I'm an internal medicine physician. I do traditional medicine. In fact, I quit going to a hospital 3 years ago. So I just do primary care and I see patients in nursing homes. So I came to know about pulse irrigation device a couple of years ago through someone. And actually, it was invented by Mr. Roy Abel, who passed away about 10 years ago. He was himself a quadriplegic. In fact, he has a little bit power in the right hand. Otherwise, he became quadriplegic while he was in college. Some disease affected him, polio type disease, and he became quadriplegic. And he was suffering with the neurogenic bowel. And he was amazing gentleman. He was enterprising. He created few businesses while being quadriplegic, and one of them was to find a relief for his fecal impaction. And so he hired few people, made this machine, did multiple studies in multiple centers across country. And but he could not, I think he had marketing challenges because he was, limited in mobility, so he couldn't travel because if you're laying in the bed and you can't poop, then that's a pretty miserable condition. So those who are using it, they love it. Many say that it saved their life. It is not life-changing. According to them, it was life-saving thing for us because otherwise, one person told me my daughter would have died without it because she was having a recurrent fecal impaction and fecal incontinence, and she had deep wounds which were not healing.
Hmm.
So we acquired the company about 2 years ago. Once we heard these stories that
All
we
right.
can make some changes in some of the people around the world.
So before we get into that device itself, so you're an
Mhm,
internal medicine physician and you see
mhm,
a lot of geriatric patients as I do. Tell us about
mhm.
chronic constipation, the scope of chronic constipation. Just give us some context before we talk about the device.
So I would say this is more for people who are who have paraplegia, quadriplegia, or spinal cord injury related things. Any reason which causes neurogenic bowel. So chronic constipation, there is a huge number of patients who have chronic constipation. Let me give you fecal impaction data. So there was a study published in 2011 in Journal of Clinical Gastroenterology. It says that yearly patients were admitted, went to ER for fecal impaction, and the cost for each fecal impaction is about 3,000 plus, and that was 2011. As you know, the cost of everything has gone up
Hmm.
tremendously, and if you are admitted with fecal impaction, your mortality is very high. Although we never think about fecal impaction can cause mortality, but most of those people have associated disorders, and fecal impaction is associated with huge mortality. So 42,000 patients are getting admitted, and we can prevent those hospitalizations, ER visits with the machine because our data, which is over the years proven data and published data, proves that patients, this can be prevented. Hospitalization can be prevented. Hospitalization length can be shortened. Like if patients are getting admitted for 3 days, 5 days, you can treat them within a day and send them back. So chronic constipation, and I'm in touch with a lot of gastroenterologists nowadays, and they say that there are patients who take Linzess and Amitiza. They have such a bad
Hmm.
constipation that they use enemas, they use suppositories all the time, and they don't have good quality of life, tremendously bad quality of life. I'll just give you an example. I had a patient, she had a stroke about 3 years ago. Now she's on wheelchair because left hemiplegia, and she came to visit me, and I was curious. Now I was not that curious about fecal infection before, like 3 years ago, but now I'm always thinking because of my company. I always think about fecal infection. Also, does it affect her?
Hmm.
And I asked her, how often you move your bowels, and the caregiver gave me answer once every week or once every 2 weeks.
Mm.
And she was on Linzess. And I was like, okay, I never thought that people are suffering and they have just taken their suffering for granted. They say, okay, this is part of life, but this should not be part of life. I mean, there are things available. She uses enema also, but enema makes a mess in the bed because she cannot be transferred to the commode. So this machine, I think, will help because it can be done in the bed without making mess.
So tell us a little bit
Yeah.
more about this device. This is what's called a pulse irrigation evacuation device. So what exactly is that?
So basically, it consists of two big jars. So one is filled with water, tap water, but body temperature tap water. We keep it a little higher so that the body temperature doesn't drop because we're pulsing a lot of fluid in the colon, in the rectum. Water is pulsed through the speculum into the rectum, and that pulse water makes the colon do peristaltic movement, and the peristalsis causes the fecal material to dissolve. And the same speculum has two parts. One is to pulse the water, another is to carry the fecal material out, which is collected in another container. So there are two containers. One is to pulse for the clear water, another is to hold the fecal material when it is coming out. About 20 to 30 liters of water is pulsed into the colon, and the procedure usually, those who are using it, it takes 1 to 2 hours. And basically, it helps the colon do the peristaltic movement, and that helps. Enema, you pulse it at once, and whatever comes out. But here, the fluid keeps on pulsing
Mm.
every 15 seconds, 30 seconds, 45 seconds, and so fecal material gets dissolved and it comes out.
So you mentioned that the typical patient for a device like this would be those with neurogenic colon, right? So, or neurogenic bowel. So tell us in
Yeah.
terms of other indications for use of this device.
So one is 100% neurogenic bowel. Many people do not know this term also. Even as physicians, we do not use the word neurogenic bowel as much, but we use neurogenic bladder a lot. We have seen patients with Foley catheters, but neurogenic bowel, even in our diagnosis, we do not write it. Neurogenic bowel, due to any reason, spinal cord injury, spina bifida, Parkinson disease, MS. So there's a huge number of diseases, which any neurological disorder basically, which affects the whole body, can cause neurogenic bowel. So that is one of the things. Another thing is for colon prep. We were studied in Houston VA hospital for colon prep because there are so many people who are admitted to the hospital,
Mhm.
and they cannot either drink golightly or they refuse to drink, and they want and we have to do colonoscopy. Nowadays, the number of colonoscopies inpatient has decreased tremendously, but still there are patients who need colonoscopy and they cannot be discharged without the colonoscopy. So we were studied for that, and a device was found to be equal or better. In fact, better. The VA hospitals are getting in touch with us because they want to do procedure and they want to have the device so that they can do the colon prep real quick. And if because one doctor told me if the colonoscopy is scheduled for next day, they have to prepare for today, and if it is not clean, then they have to wait another day. So basically, they sometimes they have to wait 2 3 days before they can do colonoscopy, and with this device, they can do within 4 hours. Okay, just get the patient prepped, and we will do colonoscopy. And patient, you make the decision in the morning, patient goes home in the evening. So colon prep also, it can be really good for that.
So tell me about the cost of something like this. Is it normally covered by insurance? Is it expensive? So give an idea of the costs for a device like this.
Hospitals, for them, it is not a big deal whenever I talk to hospitals because they have huge budgets. For individuals, the cost is about 15, 16,000. And some insurances are covering it. VA covers it. SCOMP cover it. There are a few Medicare Advantage plans which are covering it because they want to prevent patients from going to hospital ER because the ER will cost them too much. And if you have recurrent fecal impaction, that can cause major issues, especially cost-wise. And it will reduce the cost tremendously. It will improve the quality of the life. So it's $16,000, $16,000 the device for institutions as well as individuals. But individuals, many people want it to be rented. There are people who are paying out of their pocket if the insurance doesn't cover. But many insurance plans, once once the patient is ready, willing to fight, they cover it. Patients, you can sell anything to patient very easily. But we physicians, we have a barrier. All of us, oh, wait a minute, this is too costly. We make the decision based on cost so much. Okay, man, this may not be good for you without reviewing the literature, without seeing how the fecal impaction or neurogenic bowel is affecting that patient. So that is very important for us to realize that patient is already suffering, especially with the neurogenic bowel recurrent fecal impaction. They are suffering big time. There are kids with the spina bifida. They are suffering big time. There are kids with Hirschsprung disease. They are suffering big time. And this will, like, at least that misery is gone. There are other miseries going on, but you can take care of that portion of their life. And just imagine you're not constipated, you feel so good, at least you feel light. That's very important.
We're talking to Mahesh Moolani. He's an internal medicine physician. We're talking about his KevinMD article, a unique method for managing chronic bowel conditions, treating fecal impaction, and preparing for colonoscopy procedures. Mahesh, so for those physicians who may be listening to this, just again, give us an idea of typical cases that would make them think, hey, maybe they should consider the pulse irrigation evacuation device.
Yeah, so paraplegic patients, quadriplegic patients, 100%, patients with severe Parkinson's disease, MS, or the patients with severe idiopathic constipation. So any patient, to make it very simple, any patient who is using enemas, this is the device for them. They'll be feeling good for 3 days. We recommend doing the procedure 2 times a week. Some are doing 3 times a week. So 3 times a week, your colon gets clean, and it is not just a small part, whole colon gets cleaned. So any patient who's using enema, simple as that. For physicians, if you're writing enema for a patient multiple times a week, this will be very clean procedure for them. It will improve their quality of life tremendously.
Final question. Tell us some of your take-home messages that you want to leave with the KevinMD audience.
So if any physician who manages neurogenic bowel or quadriplegic patients, rehab centers, especially now the rehab centers are interested. We are being used in Craig Hospital in Denver because rehab patients, especially spinal cord rehab patients, they are having miserable condition. So with the bowel clean, they feel so good. There are patients who are into sports, the wheelchair sports. And if your bowel is cleaned, your efficiency in the sport is going to be tremendously high. Even if it gives you 20 to 30% more energy, oh my God, I'm feeling good. I can play today good. So if you're managing those patients, paralytic, quadriplegic, and just think about their quality of life and how can you improve the quality of life by prescribing this device.
All right, Mahesh, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thank you, Kevin.